stroke-related aphasia. Aphasia is a condition that often occurs following a stroke. It is a condition where someone can no longer speak in sentences or struggle to find the words they're trying to say. What follows is a case study on a client who suffered from severe aphasia as a result of a stroke. Dale was treated for his aphasia for 3 years at a stroke rehabilitation center. He was released because they felt that Dale had advanced as far as he could with their therapy processes. Dale's wife, a friend of my wife, asked if we could treat Dale to see if our process would provide additional improvement in his condition. Our response was an absolute yes, and we were excited to have the opportunity to improve Dale's life. We secured approval from the Stroke Rehabilitation Center, and they said it was fine. We enlisted the help of a speech therapist to give us some direction on ways to work with him. So Dale began his daily visits to our office for a 15 to 20-minute treatment session. For his regular protocol, we would treat the area of injury in his brain and the cognition area. We would switch up the attachments between the butterfly loop, the paddle, or the large loop. Our basic protocol was treating for 6 minutes on the area of injury, 6 minutes on the area of cognition, and then another 6 to 10 minutes on the upper chest and upper back. The purpose was to improve proper blood oxygenation and blood flow throughout the body. We began to treat Dale daily, and we didn't see anything happening for the first 2 or 3 weeks. Dale was growing impatient and wanted to see things work. At one point, he tried to quit, but we persuaded him to continue with the process because we had developed a friendship. Our protocol was to go through flashcards on his computer. We would show him a picture and ask him what it was, and then we would flip the screen and show the word. After 3 additional weeks of treatment, Dale and I began to see some improvement. He could recognize the pictures, say the words much more quickly, and make a better association between words and pictures. When he first came to the office, Dale always had a small notebook that he would use to point at words or write down what he was trying to say. Over time, he would use the notebook less and less because he could speak specific words to help move communication along. At one point in his career, Dale was a concert promoter, and I was a rock band drummer, which allowed our collective interest to spur conversations. He had worked with Jimmy Buffett, so he would pull out his notebook and point to Jimmy Buffett's name to start a conversation, but it remained a struggle. As we pursued the PEMF sessions, he would come in and ask how we were doing, and he could occasionally make complete sentences. He improved to the point that he could improve his speech and cognition by 35 to 40%. He and his family could resume some form of verbal communication that was almost totally lost. We continued the sessions daily for nearly a year, and he continued to see moderate improvement and more comfort in his conversations. We got to the point where we told his wife that we felt we had helped all we could, and that he didn't need to come daily for sessions. She responded, "No, you can't quit," and we asked why. She said it is because he is no longer depressed. He comes home smiling. He's happy and wants to talk and take walks. His depression is virtually gone, and we feel that it's a result of your Magna Wave PEMF treatments. So we continued our sessions and developed a deeper personal relationship with Dale. We concluded that the process helped him regain some speech and cognition. The PEMF sessions also enhanced his sense of well-being and helped to relieve his depression. We continued for another year to work with Dale, and he remained pleased. Dale passed away unexpectedly from other complications about a year later. We felt fortunate that we were able to use PEMF to provide Dale with a better life and a happier brain as he was dealing with life after his stroke. Depression. Clinical non-responsive depression is a condition where someone does not respond to conversational therapy, medicated therapy, or electrotherapy. This form of depression is considered one of the more severe types of depression. A case study follows of a client whom I will call Mary. She was referred to us by a friend because she was suffering from severe depression and could no longer work. She was suicidal, and she would find herself at home, unable and not wanting to go and do anything. My friend asked me if our therapy could potentially help Mary. I answered yes, and I explained that studies had shown promising results with depression. I encouraged him to have her come to the office and begin sessions so we could research and document her progression. I can say that when Mary came into the office, it was a pretty interesting sight. She came in wearing sweatpants and a sweatshirt, and she appeared disheveled. Mary wouldn't look up. She frowned all the time and could hardly move securely. We explained the therapy and told her what we hoped to accomplish. We told her that because it could take some time to begin to see results, we wanted to treat her daily. She understood and agreed, so we started our treatments daily. In addition to treating her head, neck, and shoulders, we did overall body treatments for the upper body and lower back. We also focused on her feet weekly to stimulate the reflexology points. After the initial 2 weeks, we didn't see any dramatic results, and she was very down and still depressed and ready to quit. We convinced her to continue the sessions for 3 weeks before stopping the process. By agreeing to stay with the program, she seemed to open the door for it to work because she was improving within 2 weeks. When she would come into the office, she was not as disheveled and was more alert. She would come in with a slight smile and begin walking around the office and saying hello to everyone. We treated her Monday through Friday with 20-minute sessions as we continued the process. She would regress over the weekend, and we would have to play catch up for a couple of days. Over time, it got to the point that she wouldn't regress as much over the weekend, but she would always regress if she did not continually receive treatment. After 6 months of regular treatments, she was a different person. She dressed normally, was unafraid to be in public, and started talking about returning to work. After 8 months, she decided she wanted a machine that she could use at home and treat herself. She intended to treat herself only as needed and hopefully reduce the number of treatments per week, and that's what happened. She progressed to the point that she managed herself only as necessary to support her well-being. She was able to make that transition after about a year of regular treatments. My mantra is to continue treatment as long as the function improves and then as necessary to maintain improved service. Mary wanted to work, and she worked with us part-time. She began to talk about different jobs that would fit her renewed wellness. Her love was tourism, and she found a job in travel planning, for which she has worked for the past 3 years. When this process began, Mary was on total disability and did not have a promising future. The utilization of MagnaWave PEMF therapy helped bring her to where she was able to regain the life that she so much wanted to live. While the PEMF modality continues to grow and mature, there remains much to learn and explore with pulsed electromagnetic field therapy. What I know from 19 years of experience utilizing PEMF is that whatever the condition is, pain relief leads to a happy brain. To see the research and learn more, visit PEMFprofessionals.com, MagnaWavePEMF.com, or Aurawell.com. This content is not meant to present a diagnosis or healing protocol. It is presented as anecdotal information as PEMF is further researched and developed. I am continually amazed at what we continue to learn about PEMF uses for our health and wellness. Your questions, comments, and reviews are greatly appreciated. So until next time, this is Pat Zemer. Have a great day and wave on for better health.